Dr. Ken Landau. Thanks for watching. Let's talk about Restasis. Restasis, you see advertised so heavily on the television these days. It's for the dry eye syndrome, but actually it's approved only to increase the tear production. It contains a topical immunomodulator. It reduces the immune reaction on the surface of the eye by a medicine known as cyclosporin. The drug is easy to apply. It's a white emulsion. You turn the vial upside down a couple of times in order to get a uniform spread of the medicine. Then you put 1 drop in each eye twice a day. Make sure you don't touch the vial to the eye itself, and you keep your lids closed for a few moments afterward. If you have dry eye syndrome, you probably shouldn't be wearing the contact lenses, but a lot of people do. And if you wear contact lenses, you should keep them out for about 15 minutes after you put the drops in. We know that the drops take forever to start to work. It's thought that you can need anywhere between 6 weeks and 6 months for them to become effective. And then when you put the drops in, the drops cause a lot of side effects. Side effects like burning and stinging and itching and redness and the feeling like you have a foreign object in your eye, and it can cause blurry vision for about 15 minutes, and in some people, eye pain and allergic reactions. And it doesn't seem to work if you use certain other kind of eye medicines. Well, we know that since it takes so long to work, some people recommend that you use a topical corticosteroid for quick relief, and the drops seem to decrease the burning and decrease some of the other kind of symptoms that you get with Restasis. But remember, if we talk about a 3-fold increase in tear production, we're only talking about 15% of the people. 85% of the people don't get that much improvement. Is it going to eliminate the need for artificial tears? No, it really isn't. It might make you need only 5 drops a day or 10 drops a day, but the overwhelming majority of people seem to require some sort of additional lubricant in order to ease the everyday discomfort. Well, side effects of using the medicine, as I told you, 15 to 20% of the people are going to have some eye burning or eye pain, itching, stinging, redness, discharge, tears running down your cheek that aren't the tears that you want to be produced, the foreign object sensation, blurring of the vision, side effects from injuring yourself because you touch the container to your eyeball, and the hypersensitivity reaction, the hives, the angioedema. If you take the medicine orally, as was done in laboratory animals in relatively high doses, it is known to cause certain kind of cancers, pancreatic cancer, liver cancer, cancer of the blood organs, lymphoma. But when it's used topically in the eye, you don't get any absorption, it appears. So those things should not occur. The medicine contains a vehicle. The vehicle is marketed as Refresh Endura, that's used as an eye lubricant, and as a matter of fact, early studies didn't show any difference between using the Refresh Endura and using the Restasis. The only difference is the Refresh Endura was not nearly as expensive. If it seems that you've used the medicine for about half a year to a year and it doesn't seem to work, well, then you probably ought to discontinue it. Now, there are a lot of ads that are touting another kind of a drug for dry eye syndrome that treats the symptoms, and this is known as Xiidra. And the growth of sales of Restasis, since this medicine just recently became available, have fallen by about 40%. So it looks like Restasis is going to be in for a run for its money. Now, run for your money. It seems it's a topical immunomodulator. It's for the dry eye syndrome, also called the keratoconjunctivitis sicca, xerophthalmia, ocular surface disorder, dysfunctional tear syndrome. The symptoms are pretty much the same kind of symptoms as you get from using the drug: stinging, burning, scratching sensation, sensitivity to light, your eyes are red, you feel like you have a foreign object in your eyes, difficulty wearing contact lenses, your eyes seem to get tired or fatigued. Very common syndrome. Seems somewhere between 5% and maybe more than 30% of the population suffers from dry eye syndrome. It's estimated that if we look at the senior citizens by themselves, of people over age 65, maybe about 5 million people have the condition. Now, not all of them suffer from the symptoms. Symptoms seem to be worsened in the winter time when there's a relative reduction in humidity, desert climate, or if there's increased temperature, more evaporation. It's common with contact lenses, certain drugs after you've had your refractive surgery so you don't need your eyeglasses. And it seems to come on very frequently in menopausal women. Lots of other kind of medicines available. Some people use the omega-3 fatty acids that you take by mouth. Some people put topical compresses or lid massages or tear plugs or artificial tears. And now we have Xiidra. It's thought that the condition, for the most part, may be an autoimmune disease where some inflammatory cells are interacting with the cells on the surface of the eye to irritate it. Well, we know that tears are very complicated. Tears contain some protein and immunoglobulin, some lysozyme, some lactoferrin. They also contain antibacterial substances and salt water. It has several different layers. An inner layer of mucin that helps the tears spread. The major layer of aqueous solution, that's basically salt water. And then we have the outermost layer, that's mostly fat. That's from the meibomian glands. Well, you can have an increased loss of your tears because of central air conditioning or dry, putting the heater on, maybe because there's pollution, or maybe because of wind, or maybe because you're watching the television and you're not blinking, or maybe because you're staring at the computer and again not blinking, or maybe because you have blepharitis, or maybe you have rosacea that can interfere with the fat production. Well, Restasis says that they're not afraid of the competition from Xiidra, but in spite of that, they've added a lot of sales representatives. They've increased the budget for advertising on the television. That's why you're bombarded with ads all the time. They have more samples that they're offering to the doctors. There's increased insurance coverage. Analysts suggest that maybe there's going to be about a 30% reduction in the volume of prescriptions for this compound, the Restasis, but they say that the Restasis folks are probably going to jack up the price that's already expensive by maybe about 10 or 15%. It's under patent until about 2024, so there are no generics, but it can be compounded in pharmacy. Now, at the end of October of 2016, instead of having just the individual dose packs, the company got approval for a big bottle, a bottle that you could use for all month, said to be relatively more convenient. I'm not sure about that. So what's the summary on the drug? Well, summary is that we have a drug that causes irritation in about 17% of the people, causes benefit in about 15% of the people by substantial tear production. It seems that a month's supply of the drug, if you pay cash for it, is more than $500. And if you have a coupon on GoodRx, it's about the same. So in other words, it costs $5,000 or more for use of Restasis that doesn't work very well in the majority of people. So what's my take, or what's my rating on the drug? The cost is absolutely ridiculous. And the effectiveness? It's just so-so. Anyway. Thanks for watching. I'm Dr. Ken Landau.